out and about. Anybody have any questions for our panelists? Back here.
Guillermo, I'm wondering how you found the support group that you talked about with 22 men.
I live in a wonderful place called Sunderland, Massachusetts, which is next to Northampton. And there is something that's called the Cancer Connection. It's a nonprofit organization, and they provide supports of all kinds, for women, for mixed groups, for men. They do massage, they do Reiki, they do yoga, they do all kind of stuff, and they're just, and they're right in front of the MGH satellite in Northampton, which is Cooley Dickinson Hospital. They're right across the street from them.
We have a question up front.
For Iris, who do you fly for and where have you traveled?
I'm currently working United Express, so I do domestic. I've picked up Canada flying and some Mexico. But I wanted to see how my body would react first, right after, because I think I started, I want to say 5-6 months out of my last treatment, which was the stem cell transplant, and I started right away. And I just wanted to see how I reacted, and next month will be a year. So now I'm gonna try to go big league now and do the Dreamliners, which is really what I want to do, or become a private flight attendant.
Anyone else?
First, I just want to thank you for coming and sharing your story. Just want to ask what, so I'm a radiation oncologist, and it's really eye-opening for me to hear the feedback, including the one about getting more information about support during radiation, which I'll bring back to my department. But what do you wish your medical doctors would know, or would, what kind of things do you think we could do better to help? Because during your experience, what if there were anything you really wish that your medical team could have offered you that would have made it easier? These are the things we like to know and improve.
Is that question for all of us or just?
For you.
Oh, okay. Anyone want to go? Wow. There's a lot. There's a lot. I mean, cancer is really touchy. And I mean, even with the way you say things, you have to be careful. But being a cancer patient, I guess you learn that, so I'm the oldest of 4, and so I kind of had to learn how to adapt a lot with all the different personalities. So, I mean, wow. I think if you know your patients, you kind of know what you can and you cannot say to them. I've heard some things come out of some of the people on my team who aren't on the team anymore, say some things that I mean, were mouth dropping. And I would just be like, what? and my reflector is laughing, so I would laugh and I'd be like, okay, I don't think you meant it like that, but so I've learned to realize that everyone's different and everyone does and says everything differently. So I kind of learned how to adapt to what they're trying to say to me. I would just say learning the patients, you'll know how to say certain things to them and what you can and cannot say. But I think experience helps a lot with that. And I mean, my team was great. I had a wonderful team. I honestly felt very, very, very blessed. And there were times, there was mishaps and things said, but honestly, I think it depends on the person that's hearing them, how they take it and how they react towards it. But I would just say growing experience. learning from every patient and every situation.
I might just add one thing. We've talked about the fact that cancer is it's a journey, and even though we might be done with the sort of the physical medical part of the journey, we're still in that journey. It's the the body, mind, soul journey, the El Camino Trail, whatever it is. We're still in that journey, and we still need support. And I think one thing to recognize, and I think Dr. Ryan had kind of mentioned it when he was up here talking, was that 6 months out, like 6 months out, even a year out, you may not realize this, the emotional part that you're going through. You might even still have some physical issues going on, like maybe the care team that you had, maybe just a reach out phone call, from your surgeon at your year anniversary might not be a bad idea. It just might be something to say that we care here at MGH.
I called the surgeon and the oncologist to tell them I was saying thank you for what they had done because I was a year beyond. So it can go both ways,
I agree, it's both ways. Dr. Chen, thank you for showing up.
Yeah.
You're my radiation oncologist. And what you're asking is what you're doing, which is to show up. And that is a great quality to have that we can expect doctors to have. And not all doctors are capable of doing that. They're caught up in their own, but you're connected to my art. I remember the day that you actually came from behind the desk because you heard that I was an artist and that you had a friend that was an artist. The relationship that Dr. Chen and I have is amazing. I ended up doing a painting for her that is 3 by 5, which is this woman coming down on a parachute, on a bicycle, landing on a field. And it turned out very symbolic not only of my wife, my soul, or Dr. Chen. And so I needed to paint it because she says the dream that came in was that this bicycle came in and landed on this little strip of thing and it skidded the back wheel, like you do when you're a little kid and you're really skilled. And I said, job well done. I had that dream 2 days after Dr. Chen told me that my tumor was shrinking. So the relevance between listening to my dreams, the fact that she told me that, the fact that I had the dream, and then when I start talking about my art, the fact that she showed up. And she came to the exhibit that my wife and I did in 2016, which is Yes, Life is Art, which is the art of a caregiver and the care receiver together. And that was a very powerful, and if you Google my name, my last name is Cuellar, Sunderland Artist, you can see the video of both of our exhibit, which is basically step by step, frame by frame of really what's going on. Some doctors have that ability, others don't. I am very fortunate to have you and other doctors in my life right now that are really attentive. My primary care physician, when I come, he says, have you been at the studio? Because he knows what it means to be me. And some doctors are too caught up in their own, I remember saying to one doctor that was busy trying to do the information because he hadn't read all the information when I showed up. And I went to him and I said, it's okay, read it, and when you're done, you can be with me. just do your job and finish. And that changed our relationship. So it's back to you where you're saying, is a two-way street.
Grace?
Dr. Chen, you're on my team as well, so first I'd like to say thank you. So a piece of advice I give is something that you already do, is to give the patients a voice, because cancer often takes away people's voice, like people don't know how to advocate or tell their needs. So just like having doctors like care about the patient and like ask them what they think, instead of kind of pretending that like they're not really making a decision or anything. So just giving patients an opportunity to speak as well.
Thank you. We'll take one more from the audience.
I just, a couple of things, wanted to thank Mass General for bringing the four of you into our lives. You are inspiring beyond words, and I'll never forget any of your stories. Grace, your name fits you perfectly, and you're wonderful to share what we feel and sometimes can't put into words. And kind of in today's crazy world, to know that the four of you are in it makes me feel a whole lot better. So thank you.
Amen. Amen.